If I donate blood, how many people's lives can I save? Doctor, you won't be the first person to wear gaming headphones on Baby Brunch. So a warm welcome to the coolest platform where we get to ask questions and we get to be lucky enough to ask experts like yourself to join us and to talk today about World Blood Donor Day. The fact that this important day is here and we have the opportunity to help someone. Designated transfusions is something that I learned about only recently. Why is that not encouraged?
Okay, so what a designated blood transfusion is when you donate blood specifically for someone. So we often see that in cases where children undergo surgeries and their parents or friends, if their blood groups are compatible, they'll donate blood specifically for that child for the surgery. So it is something that we do and we're willing to do, but it's not feasible for everybody to have designated blood transfusions, and we would like people to be confident in the safety of our blood supply, to know that the blood that they would get if they need it during a procedure would be as safe as possible.
So quickly take us through the procedure for someone who's never donated blood. What happens?
Okay, so you need to be between the ages of 16 to 75 and weigh above 55 kilograms. And then you'd arrive at one of our donation sites. You would fill out a questionnaire, and it's quite a lengthy questionnaire with a lot of questions, but please be reassured that every question in that questionnaire is specifically to elicit information so that we can ascertain that you're safe. Your blood would be safe for transfusion to someone else. So you fill out that questionnaire, you'll get interviewed by one of our staff. We'll check your hemoglobin level, which is by a finger prick test. And provided that's high enough, we'll invite you to sit in the donation chair, check your pulse and blood pressure, and then we'll go ahead with the donation.
If I donate blood, how many people's lives can I save?
So theoretically, you could save about 3 people's lives. And that's because the blood that you donate, and we call that whole blood, is divided up into the different components. And so from that one donation, we can make plasma products, platelet products, and red cell products. So each of those products can go to a different patient.
In the cases where minors and children need blood?
So it's not that often that children and infants or babies require blood transfusions, but there are quite a few circumstances that can lead to this. So for babies, sometimes who are born premature, their bone marrows might not be able to make enough red cells. So you might need to give them transfusions. Then you have children or babies with inherited bone marrow or red blood cell abnormalities, such as sickle cell disease, thalassemia, etc. And they'll need chronic transfusions throughout their lives because they can't make the red blood cells themselves. Other reasons would be children who have to go to theater for surgery, for cardiac surgery, and then other reasons for anemia, or perhaps a child's involved in a car accident and needs replacement of their blood. But it's not common that children need blood, but it does happen.
On World Blood Donor Day, what would your message be to all of our parents who are watching Baby Brunch?
I would definitely encourage everybody to be a blood donor or to try and donate blood. And just to, when you do donate blood, just to respect the processes we have in place. So the questionnaire that we ask, every question is there for a reason. So to be as honest as possible so that we can ensure that the blood we collect is as safe as possible, specifically for the children in the country who need it.
Dr. Carolyn, thank you so much for joining us on Baby Brunch. A big thank you to the Western Cape Blood Service. You do amazing work and we're so encouraged by what you do. Visit them on www.wcbs.org.za.
Thanks for having me.